Do you know that we never introduce ourselves in our podcasts?
What are we
in our
supposed to say?
episodes? Hi, good morning. I'm Jan Deckel.
I'm Alex McGann.
And we're a married couple.
We are that.
Welcome to Daddy Square, episode 7. Oh my God, it's almost 2 months that we're here with you guys. It was a sad week, Alex, for transgender people.
Yeah. Well, for transgender people in general, yes. But for one of them in specific, no.
Who?
A very good friend of mine,
Oh,
the
right.
only transgender person I actually know closely, had, all right, I'm going to get the term wrong. I think it's called gender corrective surgery. Is that what it's called? The thing where they do the
Yes.
thing that, yes.
And she's very happy.
She's very happy, and thank God she's doing well. It's,
Yeah, but I was thinking about her and the whole discrimination that's going on against transgender people. And I know that from my country, from Israel, it's so hard for them to find jobs. That's the thing that concerns me the most.
Yes.
It's a tough life. I mean, they follow in their dreams and they're doing what they feel they want to do, but still the society gives them a hard time. And I'm really sad about that.
So often in discrimination, we think about these really harsh things like, police treating people badly or people not being served in stores. And all of this is true and it's all horrible. But it's actually so often about money. It's about, can I get a job? Can I live my life just quietly the way I want to? And unfortunately, for trans people, that is still not quite there. But
Yes.
we'll get there, and I don't give a damn what anybody else says.
Welcome to Daddy Square, episode 7. Today we're going to talk about making babies.
Yes.
Part 1. I wrote part 1 because
Yes.
we intend to bring also a lawyer, which will be part 2. I think that there's a kind of a few angles on making
Sure.
babies as far as gay men and IVF is concerned. So
And not just IVF,
that's
but
going to
also
be
also for adoption.
yes,
need.
no, but we're talking about IVF aspects. Today we're going to talk only about the IVF, the medical procedure with the surrogate and the donor. We talked to Dr. Guy Ringler,
Reproductive Endocrinologist.
at California Fertility Partners. Before we get to the interview, I would like to remind you, Alex, that last week we talked about asking people whether they would try a pet before. Would they recommend try a pet before they try a baby?
Yes.
It's not working for us.
Tell me.
Well, we got more than 160 replies.
Wow.
60% said no.
What?
They don't recommend that. And in fact, they were really angry about that.
Oh, guys.
Pets and kids are nothing alike.
Well, I'm sorry to disagree with 60%, but, I would happily disagree with 95% if I felt that way. Look, obviously there
At least it's up. Last time you were in the 99%.
That's right.
The 1%.
That's right. No, look, I just want to say, of course I'm sensitive to the idea that you can't treat a child the way you would treat a dog or a cat in certain circumstances. And that's not what I was suggesting or asking. What I'm saying is this. Many of us live lives when we're young, working people living in the big city where the only obligations we have are to our work and maybe to our bodies and maybe to some friends occasionally. But honestly, there are no other obligations. And so my thinking is, and it was my own experience, that getting a dog, while a much lighter responsibility by leaps and bounds, a million degrees, okay? Nonetheless, getting a dog gives you a sense of responsibility and obligation that can give you a hint at what you're getting into before you go and make children.
Yeah, for example, if you want to go to the white party in Palm Springs for the weekend.
If you want to go to the white party. But
you have to think about, wait, what are we going to do with the dog?
Right. Little things like that.
These kinds of stuff that you have to kind of worry, and it's a responsibility for another, I wouldn't say human being, but another
being. Let's just say another being, someone who has a soul who you care about.
Yes.
Yeah. So, look, the 60% of you, I love you and I respect you, you're wrong. Don't stop listening to the podcast, though.
Yeah,
Love,
and
respect.
also, while you're at it, just rate and review us, because we want to increase the visibility of this podcast and help reach all these dads and maybe gay men who think about becoming dads.
Absolutely. 5 stars are lovely.
Yes, we love 5 stars and we love reviews.
Yes.
Because, should we explain why? What we need the reviews for?
Sure.
The Apple algorithm for podcasts actually works through the reviews. So
Yeah.
if a lot of people review it, the visibility of the podcast is stronger, much higher. And Guy also said in the interview, and you listen to it in a few minutes, that it's really important for a lot of people to be exposed to same-sex families, and especially to gay dad families.
Yeah. And look, as far as the reason why we want the ratings to go up, sure, we love being heard by a lot of people. It's a lot of fun. The podcast is a lot of fun. But there really is a desire that we have to make this a meaningful thing for either gay dads or prospective gay dads. And that's why not only do we want you to rate us, but we also want you to tell us about subjects that you think we should cover and really help us make this thing as valuable as it can be.
Hello again to the Gays with Kids listeners.
That's right.
Gayswithkids.com.
We are part of Gays with Kids.
All of the information and important stuff that's going to be said in this interview today are going to be listed on gayswithkids.com, the online resource for gay men who are parents. And now I think we're ready for the interview. I just want to say one thing that about this interview. We invited Guy to our house. It was a weekend where we had no babysitters, basically, and the kids are loud. You can hear them playing. You can hear them crying. Not the whole interview, but you can hear them in the background. So I apologize for that. I also apologize for Guy, but I think that what he's saying is interesting enough, and it's actually fascinating, the things that he talked about. So
yeah, this was a really good interview.
Yes.
Yeah.
So enjoy it, and I'm sure you're going to know a lot more about IVF after
Guy
this.
Ringler, Reproductive Endocrinologist.
Good morning, Guy.
Good morning.
How are you?
I'm great. Happy to be here.
Yes, thank you so much for being with us. For those who didn't go through the IVF process to become a dad, can you first explain the process, which also I think includes, what do you do in general?
Sure. I've been helping gay men to have babies through egg donation and surrogacy for about 20 years now. And it's an exciting process because it's fairly straightforward, and the pregnancy rates are very high because these are really the best possible conditions to initiate a pregnancy, because we're using the healthy eggs of a young egg donor to create the embryos, and we're putting these high-quality embryos into the perfect environment that the surrogate provides. She's a woman without infertility. So it's really... I've talked to many patients over the years about it. I go to conferences and seminars on how to do it. And I've broken it down into 5 simple steps of how to get started. Number 1 is to have a sperm test and freeze your sperm. Most men have never had a semen analysis, so it's really important to find out what your sperm count is, what the quality of the sperm is, because if you need any treatment, it can take 2 to 3 months to see an impact of that treatment with vitamins, antioxidants. So step number 1 is do a semen analysis. If everything looks fine, then we'll freeze your sperm.
So, what about, I'm sorry, I'm just going to interrupt and throw you off course every now and then. What about the underwear thing? Is it true or is it false? Tight underwear versus loose underwear.
Anything that can increase the temperature in the testicles can decrease sperm production, decrease sperm quality. So if you're really wearing really tight bikinis all the time, it could have an impact. So yes, it's true.
Have a lot of baths.
Hot prolonged baths could impact it, but you'd really have to be in the bathtub for a long time. But don't go in the steam room at the gym. That's going to impact your sperm.
Cool. Thank you.
So
step 2.
Let me just go through the 5s.
Yeah,
I'm sure there's
sorry
lots
about
of questions.
that. I'll try to control myself.
So number 2 is to select your egg donor. And I think this is one of the most important parts of the process, because not only will her genetics provide the genetics of your children, but her egg quality has a large impact on embryo quality and pregnancy rates. So when you're looking at donors, there'll be first-time donors and repeat donors. It's a little less risky to use a repeat donor because we can find out how many eggs she produced, how many embryos, and gain an assessment of what that embryo quality was. Because in general, what I see is some egg donors make beautiful eggs and embryos every time, and others don't. So by using this proven donor, you can just minimize the risk of a surprise. So once you've selected the egg donor, she completes her screening. Once she's medically cleared, she signed her contract, we can go to step number 3, which is to create the embryos. So in the embryo creation process, the donor undergoes daily injections of hormones over about a 10 days to 2 week process, in which we stimulate the development of all the eggs that she's recruited for that month. We retrieve the eggs through a simple surgical procedure. The day of retrieval, we'll thaw a vial of your sperm that had been frozen previously and inseminate all those eggs. And if we have 2 sperm providers, we'll divide the eggs into 2 groups, so each guy gets half of the eggs. The fertilization rate is about 75%. So the day after egg retrieval is day 1 of culture. We see how many fertilized eggs we have, so it's now a 1-cell embryo. Next, we keep them undisturbed in culture until day 5. So between day 1 in culture and day 5, we expect about 50% of these 1-cell embryos to become 100-cell embryos called blastocysts. So for us, a blastocyst is a usable embryo. It could be transferred directly into the uterus. It can be frozen. Oftentimes today, we'll biopsy it at the blastocyst stage and send those biopsied cells for genetic studies. And we can determine whether or not that embryo contains the correct number of chromosomes. Even in a young egg donor, 30 to 40% of the eggs in embryos will have chromosomal abnormalities. So by testing them through this pre-implantation genetic screening, we can know which embryos are normal, which embryos are abnormal. It does tell us the gender, so you will have that information as well. All the embryos are graded, so we'll know how many normals, abnormals, and the grades of the embryos.
And grades are about likelihood to come to term? What is the grade measuring, really?
It's a great question, because before we had the ability to genetically test them, we relied exclusively on the grade, and the grade is really how pretty the embryo is in culture. It doesn't correlate all that well with the chromosomal makeup, so it's just it's another variable that we factor in. So when we're selecting an embryo to transfer, we're going to select the embryo with the highest grade that's chromosomally normal, and then we'll go through the list. And the goal from this treatment process is to end up with anywhere between 4 and 8 normal embryos. So that's why careful selection of the donor is important. Some donors will make 12 eggs, others will make 38 eggs. I did egg retrieval this morning on an egg donor. She made 38 eggs.
Wow.
And that's helpful when you have 2 sperm providers, because you each get a nice number of eggs, and we have the ability to select the highest quality embryo for transfer. And it gives us multiple attempts at a transfer.
Right.
My goal is to get my patients pregnant, from this first donor cycle. Hopefully the first embryo transfer, but you don't want to have to go through another egg donor cycle because it just adds to expense.
Got it.
So that's
Did we just get through the 5? I can't remember because I kept interrupting.
Well, number 3 was creating the embryos.
Right.
Number 4 is selection and screening of your surrogate. It's very important. Surrogate mother, a basic minimum requirement is that she's had at least 1 pregnancy, uncomplicated, that she carried to term. Ideally, not more than 5 pregnancies. And she should be in good general health. And we carefully look at her past pregnancies to make sure there was nothing about those pregnancies that would make her high risk in any way. again, we want to provide this optimal environment for getting pregnant and carrying that baby to term. So the next step, number 5, is to do the embryo transfer.
Basically, gay men, it's kind of relatively new, the whole IVF for gay men. And some of these gay men who arrive are older than 30, I would say. How much does it affect the success of the embryo's creation?
In general, men are much more protected by age than women because women are born with all the eggs they'll ever have, and every month they ovulate one and lose some. So with age, the total number of eggs remaining decreases, and the chromosomal makeup of those eggs changes, so that as a woman gets older, more and more of the eggs are abnormal. Men continually reproduce sperm throughout their lifetime, so we don't see this chromosomal impact in terms of numbers of chromosomes in sperm with aging. There's some decrease in sperm motility in some men, decrease in count, but they're much more protected by age. Now, there are a collection of studies looking at what impact age does have on men, and we see slightly higher rates of autism in the offspring and some other single gene mutations. So there's a slight increase in some diseases in men over the age of 40, but it's difficult to quantitate.
And those are not things for which there are currently genetic tests in the embryos?
There's not. We can't test an embryo today for autism.
Got it. Yeah. Okay. I have a million questions. Who goes first?
Go ahead.
So I don't know if Jan told you, but the children in the other room came through this process. We did as much homework as we could before we went into it, but this was a very confusing process for us. And
how so?
Well, the basic biology of it, the steps that you just described, I think we got, right?
But
amazing
not
though they
really.
may be.
So that was my question, basically.
Go ahead. You start with your question.
We went with a company who switched, according to your stages, stage 2 and 4. So they first made us choose the surrogate.
Okay.
And then only at the end we chose the egg donor. What ended up happening is that the egg donor didn't provide enough eggs, and we didn't have. So we wanted one of each.
Right.
So we wanted twins or twiblings, we call them. But what happened is that the surrogate started the whole hormone therapy while the egg donor was doing that as well, and then we didn't have enough eggs, and we didn't get to
we didn't have enough embryos at that last moment. And so one of the questions, one of the things that we would like to have understood ahead of time is this aligning of the time frame by which, for what they call a fresh cycle,
right,
where the embryos are not frozen, but are, as the moment they're ready, the surrogate is ready to implant them. There was a challenge financially, which was we had to have our surrogate ready to go, and she was ready to go, but our embryos were not. So we ended up doing it again, frozen, and thank God everything came out right. What we learned, at least from our IVF doctor, was, as far as he was concerned, the frozen cycle wasn't a problem to begin with. So I guess one question we have for you is, there's a tremendous convenience in the frozen process.
Right.
Do you see advantages from percentage that succeed, et cetera, to the fresh over the frozen? And what would you do?
Okay. Well, great questions, because there's been a change in the standard of care in the last 5 to 10 years, because the protocols for freezing and thawing of embryos has changed and improved over the last 5 years. So 5 years ago, I think most programs were synchronizing egg donors and surrogates to allow for a fresh embryo transfer, because at that time, fresh embryos had higher pregnancy rates than thawed frozen. Today, for most programs, but it varies from program to program, most top programs, the pregnancy rates with thawed frozen are the same as fresh.
Most
IVF programs.
What was it you used the term?
top IVF
Oh, I see.
programs.
Most top programs, right.
So I
Okay.
think, you really need to ask your IVF program, do they see a difference in their fresh and frozen pregnancy rates? Because today, most programs will create embryos, freeze them, and transfer a thawed frozen into the
Interesting.
surrogate, which does make it's a little simpler that way. You don't need to synchronize. You can create embryos in advance and wait to find a surrogate later. And especially if you want to do genetic screening, it's more optimal to biopsy the embryo and freeze it. And you get results about a week later rather
Right.
than doing a fresh transfer.
And you mentioned 32 eggs this morning. Did you say 32?
38.
38?
Yeah.
Oh, my God. Because I think we had six. So
6 total or 6 apiece?
6 total.
Ooh,
But,
okay.
we squeaked by. We wanted 2. We got 2 kids. That's all
Fantastic.
that matters.
That's fantastic.
But the question I guess I have is this. So I have to imagine there is a medical cost associated with each fertilization. No,
it's really for the collection of eggs.
Really?
So there's one cost for the collection of eggs, and that's why in your donor cycle, my goal is always to retrieve between 20 and 30 eggs.
Oh, wow.
Because that gives me enough eggs and embryos for multiple attempts. And we're doing more and more genetic testing of embryos from egg donors, and we're finding abnormality rates of 30 to 40%.
Wow.
So you have to have enough embryos to test because 30 to 40% will be abnormal.
Now, I may have discussed it with our doctor at the time, but most of my memory has been wiped since my children were born. What is fertilization? Are we actually talking about manually pressing the sperm into the egg? Is that done with like a machine, or is it they just squiggle their way in there?
There's 2 ways to inseminate the eggs. You can just mix sperm with eggs and let them fertilize spontaneously, and you'll get a fertilization rate of about 60 to 70%.
Okay.
Or you can use a form of assisted fertilization that goes by the acronym ICSI or ICSI, where under the microscope, the embryologist takes one normal shaped, normal swimming sperm and injects it into the egg.
Yeah, I've seen
So
the
that
videos
will
of
give
those.
us a fertilization rate of 75%.
Interesting.
So for men with any sperm abnormalities, you have to do ICSI.
Got it.
With in our egg donor program, we always do ICSI to ensure a normal fertilization rate, because there's a 3 to 4% of unexplained fertilization failure in this expensive egg donor cycle. That's sort of a disaster.
Right.
For everyone.
Oh, interesting.
For gay men to choose an egg donor, it's kind of, I would say it's overwhelming, because you kind of get to it and there's like hundreds of them and you have to go over each one to make sure you're not missing anyone. What's the best way to choose an egg donor?
You should start by making a list of characteristics that are important to you. Ethnicity, hair color, eye color, educational background. Maybe you want someone with musical talents. Make your wish list. And then when you're going through profiles, of course you're going to be attracted to some and not to others. You sort of have to go with your gut. I like her, something about her. You read her story and it touches you. Then you go to the next level. Well, how many eggs does she make per cycle? Is she going to be a good candidate? And I usually have my patients send me their 3 or 4 favorites, and I'll screen them medically. I mean, just their profiles to look for any red flags.
Right.
But you really have to go with your gut. I mean, look, how did you meet your husband? How did you choose him?
He had a list of
dashing
35.
good looks? Was it?
He whittled it down to 4.
Actually, we actually screened all of them, first of all, by health. So we looked for the healthiest
Right.
records, and then from it, we looked for the right.
That's good.
Oh, it
So,
was a pretty crazy process of
it took
printing
a
things out
few
and putting them
Yeah.
on the floor and, mushing
I've had
things
many
around.
patients say they get overwhelmed by it. So
Yeah.
when you're looking at health, you're looking for family disease. You look for clusters of disease. There are a lot of alcoholism. There's a lot of heart disease.
Right.
And you keep looking. So,
How many patients or clients, I don't know what do you call us?
we're patient.
Patients?
You're patients to me.
Okay. Have you had who use an egg donor whom they know? What's the
I'd
frequency with which
say
that happens?
about 40 to 50% no.
Oh, wow.
Because you have the option of knowing your donor or being anonymous.
Right.
And it's always nice when you get to meet the donor because then you can create this storybook for your children. You know, this was our egg donor. You, of course, you'll always know your surrogate. This is who carried you. So your children from an early age have an understanding of how they were brought into this world. And it's nice for them to know that. Just the other day, one of my receptionists said, "Oh, Dr. Ringler, my daughter, her daughter's like first or second grade, came home and said one of her friends told her she was a Dr. Ringler baby, and another girlfriend came up and said, oh, it's a Dr. Ringler baby too." And I was just amazed that these young children at an early age understand how they were created, which is fantastic. So they will grow up that it's all normal and natural.
How long have you been doing this, did you say?
27 years. So
you could have some,
that's a long time.
Grandchildren.
Wow. Yeah, right.
That's right.
So recently you went to Men Having Babies convention in Brussels to speak. So when you go to these conventions, what do you talk about usually?
Well, I've been on the advisory board for Men Having Babies for the last couple of years, and this nonprofit has two main missions. One is they offer resource fairs for intended parents to find out how men can build families, have children. And secondly, they offer scholarships programs because we all know this is not inexpensive. And so every year they offer some pro bono cases and some discounted cycles, which helps men who can otherwise afford it to have children. And so they usually ask me to give a talk as part of a medical panel. Today, in Brussels, they asked me to speak on fresh versus frozen embryo transfers and the technique of an embryo transfer. But we're always assigned a different topic: how to choose an egg donor, the IVF process, how to screen a surrogate.
Oh, that's great.
But they're wonderful resource fairs, and they have them around the U.S. They have one in Tel Aviv, and next year we're doing Taipei.
Wow. So do you work directly with a specific agency or anything like that when it comes to finding the egg donors and the surrogates, or are you completely separate from that process? And
I'm independent. I work with about a dozen or more different agencies. There's surrogacy agencies and egg donor agencies. Many surrogacy agents have egg donors within their program as well. And we're fortunate to live in California, which is one of the safest places in the world for surrogacy for the intended parents. And some of the best surrogacy agencies in the world are located in California.
Got it.
You have a lot of professionals, because it takes a team of professionals that work well together to make this all happen safely, legally, correctly.
You were talking a minute ago about the money, about the cost. The cost is nothing to sneeze at.
Right.
Is it coming down?
No, actually, it's going up
Because of the options for testing?
It's going up because everything gets more expensive. Our petri dishes are more expensive. The technology gets more expensive, actually. And there's such a demand for surrogates that the amount that the agencies have to pay the surrogates goes up.
Wow.
So it's gradually increasing. And it's not inexpensive. It's something you have to plan for. I always tell my patients it's somewhere between the cost of a really nice car and a small house in the Midwest. And you have to plan. I have some younger patients today whose parents are paying for it because they want grandchildren.
Right.
And they want their
we should have thought of that.
Children to have families like they did.
Right.
Which is really fantastic.
So what are the percentage of success for a single baby and for like what we did? I want to know if it changed from like 3 years
Transfer
ago.
one or two.
One of each or one in general?
Yeah. Pregnancy rates, most programs, including ours, we do mostly single embryo transfers now. We used to transfer two to increase the chance of one. But now that we're better able to assess embryo quality through PGS and other techniques, we're trying to avoid the risk of twins. Since twins is a high-risk pregnancy from the beginning. So in our last series, we had a clinical pregnancy rate of 79% transferring a single embryo transfer.
Wow.
So that's a gestational sac with a heartbeat. Live birth rate will be about 5 to 10% less than that. So, but you're about 70% live birth rate transferring a single embryo.
That's
So
amazing.
if you put in that second embryo, pregnancy rates go up maybe 5 to 10%. Not as much as you
Go
would
down.
think. Go up.
If you put another one?
You
For
put in two
if you put in two,
embryos,
Right.
just slightly higher.
But we wanted from the beginning. We wanted twins.
Right.
People come to you with that request as well.
We do, and we will put up to two once
And-
we've
and
talked
what
to them
is-
about the risk of twins. And the twinning rate's about 40%.
Right.
So it's about the same.
Yeah, it's about what
Yeah.
we.
No, even
Yeah.
with genetic testing, it's not. You would expect it to be higher. 80% twins is not.
So you mentioned that from the time of a pregnancy, as you defined it, to birth, the chances that it's going to work go down by what was something 5 to 10%?
5 to 10%, depending where your starting point
Does
is.
that have anything to do with IVF, or is that the same situation for any pregnancy?
Well, actually, it's related in general to the age of the woman producing the egg. In this, and the chance of it, in this case, depends on whether or not PGS was done. Before PGS, miscarriage rates would increase, in proportion to the age of the woman producing the egg. Now that we can screen out most chromosomally abnormal embryos, the miscarriage rates have significantly decreased. But there's still going to be, about 5 to 10% miscarriage rate.
Now that's interesting to me because PGS, I'm assuming, which stands for, by the way,
Pre-implantation genetic screening.
oh, there you go.
And there's they've recently changed it to PGT, pre-implantation genetic testing. Not to confuse you, but just in case
Okay.
anyone has heard PGT.
Good, thank you. So I'm going to assume that can't be done on a natural pregnancy. Is that true? Meaning you can do it with IVF. You can't do it when a man and a woman, do the thing and make a baby.
No, you can do a peripheral blood. You can have a blood draw around 10 to 11 weeks.
I see.
For the chromosomal
I see.
makeup
Okay.
of the pregnancy.
So in the end, both types of parent can find out the same information, but a little bit earlier for the IVF.
Yeah,
parent.
the advantage of PGS is you test before you've initiated a pregnancy
Right.
to avoid the Down syndromes and other trisomies that could result in a miscarriage.
Got it.
What is the percentage of gay individuals who come to you for IVF? Like,
You mean how many of them are gay?
no,
Of his total
like
patients?
how many are single?
Oh, single gays.
Single gays who come.
Gotta think about that
And
one.
if-
So of
if
the
it's
gay
good-
patients, probably about 25-30%.
Wow,
You
I
know,
wouldn't have guessed that.
no, I think once men decide it's time to have a baby, they're committed, and they, and in my experience, my single gay men who start the process somewhere along the way, they always ultimately meet Mr. Right.
Yeah.
There's nothing like having a new baby and I'm seeing single straight men.
Really?
Deciding they want to start their
Wow.
family. They have been unlucky in love. It just hasn't worked out. And, they're turning 50. They want to start a family.
That's amazing. In your line of doctoring, the patient, I guess, is the prospective parent, right? Because the embryo doesn't come along until the end of the process. Do you ever find yourself telling a parent, you shouldn't do this? You ever find yourself understanding the parent and who he is or she is and saying, I'm not sure that this is right for you, not necessarily physically, but for any other reason? Would that ever present itself to you, and would you feel comfortable talking to them about that?
Wow, that's
Yeah,
a
I dropped
serious
that.
question.
I dropped that little bomb on you.
Fortunately, I can't recall being in that position, at least not recently. Maybe 15, 20 years ago, we had a patients that were cousins, and I didn't want to, if you feel uncomfortable treating an individual, you can always refer them to another respected professional in the community. I haven't had to do that recently.
They show up and you suspect that they're major druggies. What do you do? I'm serious. I'm sorry. I didn't promise you I wasn't going to ask you any tough questions.
And that, I haven't seen that. It's a great question.
Thank God.
What I would do.
Will they have enough money to do it?
Are you kidding? Sure.
I think it's important that patients are really committed to the process and to the children.
Right.
And because you're doing this for the love of that child, because I've asked myself, well, what do we need to give that child? We need to give it two parents. We need to give it mom and dad. What do we need to do? What do we need to provide? All you need to provide is love.
Yep.
And these individuals who come, they feel very strongly. They want to love a child. They're committed to the process, which it takes some commitment.
Yep.
And takes some money. But they're doing this because it's really important to them. We all always have the chance to refer patients to psychologists if we're concerned about how committed they are. Do we think they're really, they're doing this for the right reasons? And I would refer them to a clinical psychologist to gain an assessment.
Well, that makes perfect sense to me.
When is your part of the process ends?
I follow the surrogates until the placenta starts making hormones on its own, and we're ready to wean her off hormones. So that's usually about 10 weeks of pregnancy. And then she goes to her obstetrician, usually the doctor who delivered her children. And then, because then the pregnancy is really self-supporting, and she goes to her regular pregnancy appointments.
Is that what Carly did? Did she go to her? Okay, that's our surrogate. Our wonderful surrogate. Hi, Carly.
I read somewhere that there's something right now in development that maybe you can turn a sperm into an egg. Is that something that because I think the dream for gay couples is to have like a
absolutely.
their own child.
Absolutely. I think the science technology is advancing. I think someday we have the ability to change to stimulate a cell to turn into an egg or a sperm.
Wow.
And so two men theoretically could produce a child using their own genetics. In fact, my very first gay couple I treated, they wanted to use the egg from the sister of one of the guys and the sperm of his partner, because that way their child was a mixture of their genetics.
That's amazing. Now, wait a minute. I have to ask you a science question. So if that was possible, that would mean that two men could have a boy or a girl, but two women could only have girls. Is that right? Because where would the Y chromosome come from?
Correct.
Oh, I got it right. Wow. I remember a little bit of biology.
That's a good question.
Let's talk a little bit about you. What made you want to become a fertility doctor?
Well, originally I was going to go into high-risk obstetrics. I did my OBGYN training at the University of Chicago, and we saw a lot of high-risk cases in the south side of Chicago. And I thought it was very interesting because it was a combination of internal medicine and regular obstetrics. You got to manage problems. But I realized that in many ways obstetrics, you're handling emergencies and disasters because problems in pregnancy can just arise, and you have to respond to the best urgent care solutions. And that made me a little uncomfortable. Around that time, IVF was a new worldwide phenomenon, so the field of reproductive endocrinology and infertility was just exploding.
Wow.
I remember in Chicago, everyone was very excited because Dr. Richard Mars, who helped make some of the world's first IVF babies, was coming to give a lecture, and everyone was so excited to hear him speak. And he's my partner today. We've been practicing together for 27 years. So it's a wonderful profession. I feel lucky to do what I do. I get to help make babies and help people build families and fulfill dreams. And I have wonderful patients, and I wouldn't trade it for anything.
So you have kids?
I do not have kids.
You don't? You could probably whip that up pretty fast.
I know. But Mark, my husband, I wish we had kids, but we got together later in life, and I'm 61, he's 62, and at some age you have to say it's
Right.
we're a little too old. Well, we're not too old, but you make decisions. I think when I was coming out and dealing with my sexuality, it was really difficult for me to give up the chance of having kids because none of this was available back then.
Yeah, right.
And so you go through these stages and you give it up, and then you become okay with it. But that's why I'm so passionate about helping gay men have babies now. I love it when these 25-year-old guys walk in my office and said, "Okay, we just got married. We want to start a family." It's just fantastic, right?
It's amazing. It's
And their
amazing.
parents are paying for it, and they're gonna build this big, beautiful family.
Yeah.
It's pretty foreign to me. I mean, we did this pretty late, and I think that coming out when I did, the idea that I would do something as normal as having children just didn't seem even. It didn't make any sense to me at the time. So it's very exciting to hear that you have patients that are looking at this as a rite of passage, as something that they want to do and that's part of a natural life, because it certainly wasn't that way for me when I was coming out of the closet.
Tell us a little bit more about coming out.
When and where?
When and where?
I think it was a process in medical school in Detroit. So one of my classmates said, "Guy, you got to go to this great gay bar." I was scared. I'd never been to a gay bar, and I actually did a blog about it in the book, and it was just enlightening because, wow, everyone looks so normal, and they look like me.
Wow.
And it was fun, and you could be yourself, and but it was in Detroit, and it was in a not so nice part of town, and security guards in the parking lot, so you had to walk in very quickly.
Right.
But it was a chance to be yourself, and it's medical school.
We're coming towards the end. Alex, do you have any other IVF-related questions?
I don't, but I do want to say this. I don't know that we had the opportunity to say this to our IVF doctor, but you're all IVF doctors, so I can just say it to you. It really is, what you just said before really is true. What you do for a living has enabled me, I'll speak for myself, to achieve something that really never felt possible. And I have a family that feels more... It didn't feel so natural in the first few months, I'll be honest with you, but feels more natural to me now than I ever thought would be possible. And sometimes you see an example of where science, medicine, whatever, contributes to humanity in such an incredibly bold and powerful way. And thank you for that contribution, because it has meant the world to me.
So nice to hear how happy you are and fulfilled.
I mean, if you ask me a few hours from now, I'm going to tell you it's a living hell. But,
when the babysitter leaves.
When the babysitter leaves.
By the way, we touched the issue of choosing the egg donor, but we haven't talked about the surrogate. Usually, when you go to these companies, they match you up with
agencies.
Surrogacy agencies.
Yeah, so they match you up with a surrogate. How do you know when what they did with the match is not for you?
They should present you with several profiles to look at, and you can read about their family picture and where they live and how many kids they have. And I always advise my patients to choose someone that you can relate to, you feel comfortable with. She's carrying your baby for a year. And you'll briefly look over the medical history, but before I see her for a medical screening, I'm going to thoroughly review all of her prior pregnancy records to make sure there's nothing about them that was high risk, to make sure she's a viable candidate. So then it's a matter of you have a good match, and it's important that the agency matches expectations on both sides. Some intended parents want to be very involved in the surrogate and become best friends. other intended parents want her to do her job, but they have busy lives. They don't want to be that involved. And the same from the surrogate side. So it's important that you match expectations so everyone feels content and no one is disappointed in the process.
Thank you so much for coming and talking to us. I also thank you. I mean, thank the profession, but for what you do, I think it's really amazing. And the fact that you go and talk about it and help other gay men to even decide in the early stages, I think it's great.
I think it's really important that we talk about it and share stories, because that's how we let people know that this is possible and it's available. We're really fortunate here in California. I just got back from Italy and France, and Italy, we got shut down from talking about surrogacy. The police came.
Wow.
Because it's such a controversial subject. And they came to warn us that there would be protesters. So we just said, we're not going to do this. We're here to help people. We don't want to get anyone in trouble. The same in France. So we're very fortunate to live in a part of the world where all this is possible. So, but we have to share our stories. They need to hear about your boys.
Yep.
And, we all need to be out and active and let the world know that we make happy, healthy, normal families.
Exactly. This is why we're here.
This is why we're here. Thank you so much.
You're very welcome. My pleasure.
That was Guy Ringler.
Reproductive Endocrinologist
At California Fertility Partners. I can't say these words. It's too complicated for a foreign person.
I like to say reproductive endocrinologist.
Yes, so he's not a gay dad.
Nope.
But he's gay, and the fact that he helps so many gay fathers, and he's so sensitive about this.
Yeah.
And also the things that he wrote to me after the interview, which was really touching. That he said that Ben and Adam grew up in a loving home, and it was great to see that. And he only saw us for a second, and he saw us in a day where there's no babysitter, which means the house looks like a tornado.
Yeah, it looks pretty bad.
I don't know if I should say tornado. Is it not? Is it insensitive?
It depends on what's happening in the news. You can get away with it today. The house once again today looks like it's not good. It's not good. But I think that the kids behaved themselves relatively well, and so did Guy. And I did want to say that I was sort of touched by the way he spoke about not having had kids of his own. And he talked about the fact that he had built his career and he had done what he has been doing for all this time, and that at his age and stage of life, he felt that he was not young enough anymore to have kids. And I understand, believe me, I understand exactly what his thinking is. But it's hard because you look at somebody like that and you say, oh man, you would be an amazing father, and look what you could bring to a kid, even if you were a super old man by the time they were, going off to college.
Yeah.
So there's
I
a
think
lot
it's
of
a decision, because a lot of, not a lot, but I know gay men who became father at 60.
Yeah.
Our neighbor.
Yeah, no, I mean, it absolutely happens. I will say that on a very practical level, I guess that the older you are when you have kids, the more important it is that you have money.
Yes.
That you have money, that you have a good life insurance policy, because if God forbid something happens, if nothing else, the kid or kids have to be, protected.
Yeah. So another thing that I wanted to clear, and that's kind of a personal point of view, it's the fact that what happened to us with our story with the surrogacy, because we lost, and I wrote a complete article about that, because it was very important to me for other couples to not make the same mistakes as we did, and this mistake cost us $60,000.
I think it was 70, but okay, it was a lot.
What happened is that our agency kind of tried to push us through a different path than what he explained. They wanted us to find the surrogate first, and then find the egg donor and do a fresh cycle, which he explained they do it simultaneously.
As Guy explained, until 5 or 7 years ago, it was considered the more successful way to do it. It was that you want to get your surrogate to start shooting up hormones and your egg donor to start shooting up hormones at the same time, get them both kind of synchronized so that when the eggs come out, when they harvest the eggs and they create the embryos, at that moment they can implant the embryos in the surrogate, and the surrogate is ready to receive them. And so everything has to be lined up perfectly in time in order to do that, and that's called a fresh cycle.
So what happened with us is that there weren't enough eggs when they did the retrieval, and then therefore we didn't have the embryos ready, and we had to do another cycle with the egg donor, which took something like 6 months or so.
Yep.
And then all the money that we spent on the hormones treatment for the surrogate and the surrogate is just gone. So what I suggest to do is, first of all, be persistent and learn more about the process so you know exactly what you're up against. And also find the egg donor first, make the embryos and freeze them. And you have time, and then you can pause even to try to collect more money and whatever. You can do a pause between the embryos and finding the surrogate and do the whole thing. So it also makes the process more easier financially.
Yeah. That reminds me of something I wanted to just mention. So when we did this whole process, we read about it, we got advice from various people. But what we did not have, and I don't know if such a thing even exists, but I'd love to hear feedback from people who have gone through IVF as parents if they think that this would be good. I think it would be great to have an IVF consultant. This is a person who you pay, I don't know, maybe $1,000, and their entire job is to be able to answer your questions, but be completely independent of the agency, the surrogate, the egg donor, the doctor, so that they have no interest other than to help you. This is something that we talked about with our surrogate that she should do as a side career.
Because she just knows everything.
Amazing.
She knows everything.
And so I think that, I'd love to hear people's feedback of whether they would have liked that. I know that we would have been thrilled to have somebody we could call that, frankly, we could trust and just say, oh, what does this mean? What should we do here?
But of course, you can also call us, or at least write us at hello@daddysqr.com. You can tweet us at Yanir Dekel, and you can find us on Facebook at Daddy Square. Also, if you go to Gays with Kids, they can forward the questions to us, or, just answer you because they know too. I think that's it for today.
Sage advice.
Sage advice.
What is your sage advice today?
So here's the thing. So I started to read an amazing book by the guru of Israeli parents. Her name is Einat Natan. She's kind of an advisor for parents. She's a lot on TV and on the media all the time, kind of helping parents to deal with some sort of stuff. And she just released her book. One of the things that she speaks about there is the tantrums, how to deal with tantrums. And
your children's tantrums, just to be clear.
Yes. And especially when they're toddlers and they hit you and they don't understand what you're saying and they call you names. And what she says is basically that kids, they have a tantrum when they meet their limits. Sometimes they try to push their limits, and if we be persistent enough, they're going to eventually learn to deal with limits in life. And also, what's the most important thing, and that's my sage advice for today, because it completely changed my life and the way I handle my toddlers now, is that she always says that the tantrums are not about you. Even if they call you names and hit you, it's never about you. Don't make it about yourself. It's about the limit. So you can both come together and be angry or be frustrated about the limits. If your kids are having a tantrum, you can say, I understand that you're angry. I understand that that sucks, that you can't have it now. Let's be frustrated together. This week, I brought them home from school, and they wanted a banana, and there was no banana in the house. So I told them, let's go to the supermarket and buy banana. And Ben started screaming and crying, no, I want banana, I want now. So I said, you know what? Why don't we all sit in our kitchen and just scream together, there's no banana. And we screamed, no banana. And that's it. So I think it was, I don't know, it was
good.
liberating. Also for me, because it's annoying. So you scream about the banana, but just actually think about something else.
Right.
But we all did it together, and it felt like it's not about me, and it's not about our relationship. It's about the banana.
I like it. My sage advice is about celebrating yourself. Okay, that sounds a little bit Los Angeles and, nauseating, but there's something to it. When you are a parent, you spend a lot of time worrying about your kids, but you also spend a lot of time being frustrated, and you spend a lot of time in self-recrimination. I didn't do it right. I screwed it up, right? And then when things go well, they just go well. My sage advice is to celebrate yourself. So in the mornings, I take the kids to school, and very often that is not a smooth process. It involves screaming and crying and throwing things.
I don't want to go to school.
I don't want to go to school. A lot of difficulty. But every now and then, I'll have a morning where everything will work beautifully. Everything will be smooth. I know how to play the children like a Stradivarius, and each child goes where they're supposed to go, and they smile and they giggle and they laugh, and then they slip into school and poof, they're gone. And on those days, I am starting to do this thing where I send a text to Jan as I leave the school that says, I am a golden god of parenting. And it's a little bit over the top, obviously, but my point is this. You know what? When you manage to do it really, really well, take a moment to praise yourself and to praise your partner also when he's doing an amazing job. Because those moments of really excellent parenting may be few and far between. When they happen, celebrate them.
I think it's right about everything in life, not only about parenting.
Yeah, but this is not a podcast about everything in life. But you're right. I agree with you.
You guys, thank you so much for listening to us. And don't forget to rate and review. And also, if you want all the details about the process that Dr. Ringler talked about, plus other links to our articles that he had written in the media, you can check out the page at gayswithkids.com. You can also write us at hello@daddysqr.com, and we really hope to hear from you. And that's it, I think, for today.
We have to talk about creating merchandise. I'm thinking about
Alex, stop thinking about making money.
Little action figures of you and me with little heads that bounce around talking. No, not good.
No, that's.
Damn it! This was my $1 million idea. Oh well.
No, it wasn't. Alex, have a good week.
You too.